when I try to explain that to producers or to clients, we consider two type of face mask, and we explain that very easily so they understand the difference. So those designed to protect yourself, to protect the person that is wearing it, and those would be an example are those N95 or FPP2, as we say that in Europe. Those are high efficiency filters masks that stop at least 95% of the smallest particles of 0.3 microns that from getting inhaled. So they only allow these small particles 5%. The others are stopped completely. And those are high efficient masks that are really designed to be under a high infectious environment and to protect the person that is wearing them, as I said. But the other type of masks that are designed to protect others. So those are surgical masks or any homemade face mask or covering. And those will stop large particles from getting spread, so getting emitted from your mouth when you sneeze, when you cough, or even when you are on a normal conversation.
Hello. Welcome to this podcast in the Meet the Expert series on swine health management in practice, brought to you by Boehringer Ingelheim. My name is Peter Bess. In this episode of Meet the Expert, we will be talking about farm biosecurity, but with a difference. Normally, of course, our biosecurity measures are aimed at protecting the health of the pigs. This podcast is different because it discusses what farm operators should be doing to protect the health of their farm workers, specifically against the novel coronavirus that has caused a worldwide pandemic in 2020. I'm delighted to say that the expert to help us with this important topic is international swine veterinary consultant Dr. Carmen Alonso, who's based near Barcelona in Spain. Welcome, Dr. Alonso. Thank you for joining us.
Thank you, Peter. Thanks for your invitation.
Dr. Alonso, in your career, you've made detailed studies of the transmission of viruses. In your expert opinion, could pork producers be doing more to keep this coronavirus away from the farm and so keep their workers safe?
Let me tell you that swine workers are well trained on disease transmission and with a special focus for swine diseases. But in this case, it's different. In the case of this coronavirus that affect humans and no pigs, they need to be careful on protecting themselves and protecting others inside and outside the farm. So it gets a bit more complex.
And are veterinary advisors the right people to be advising farms about an issue of human health?
Absolutely. Veterinarians are commonly employed as public health professionals globally within regulatory bodies, in governments. They play an important role on food safety policies, grading policies. They are they are very important on zoonotic diseases, anything that public health related, where there is a human and animal interaction in general. So, but more specifically, as we are food animal veterinarians, and we deal every day with herds and large group of animals. What we do is population medicine. So we can consider ourselves a population medicine expert. And that's an advantage because some human doctors work most of the times as an individual level.
And if we talk about taking extra precautions to keep the coronavirus out of our population, being the farm workers on the farm, for how long should these extra precautions last? Are we talking weeks or months or years? How long?
I'm afraid at least until we can get the protection from a vaccine, and that's it's getting closer, and we can see how different parts of the world and different groups of scientists are advancing, and their trials on humans are getting promising. So we need to wait for that. We need to wait for the vaccine protection.
Until then, we've got to be vigilant. We've got to be alert.
Correct.
Yes. By the way, I've been calling it so far just the coronavirus, but there are other coronaviruses, of course. This one seems to have several names, depending on whether it's been discussed in scientific circles, on farms, or out in the general public. Could you just clarify for me, please, when you talk about the human health risk, what do you call the virus?
So it gets a long one. So it's a severe acute respiratory syndrome, coronavirus type 2. It's in short, this is SARS-CoV type 2. That's the name that has been given to this novel coronavirus that was discovered in 2019. But the name of the disease, that's what we call the disease, is COVID-19. That's the human associated disease with this SARS-CoV type 2.
Oh, thanks. Now, okay, SARS-CoV2, the coronavirus. Is there any evidence yet whether it does or does not infect pigs? You referred to earlier saying it doesn't, I thought.
It
Is there any
doesn't.
evidence of that, that it does or does not?
There's no scientific evidence that is affecting any livestock at all, and funding so far for research are indicating that they are not susceptible to SARS-CoV type 2.
So not pigs then, but I have seen one study, in fact from China, reporting that the virus infected cats. And I think we've heard from France there's been another incident there too in cats. Should we regard cats on farms as a risk in the coronavirus context?
Well, specifically, there is no current scientific evidence on dog or cats playing a role in spreading SARS coronavirus towards humans, right? But as a general, like we are concerned about having cats and dogs at the farm, but that's from our overall biosecurity perspective. They roam around, they can eat wild animals. So as a general, we try to prevent having cats and dogs at the farm. But it's a very different situation having a cat on a very on a on an environment where the risk of infection is high, like on an affected household where the owners of the pets. Of in this case the cats are infected, so that's what happened in those studies. So that's the environment of these pets surrounded by patients, right, with infected with COVID. That's what made the animals, the cats in this case, infected. But there's no risk of the cats getting people infected.
I see, not from cats to
No,
people.
from cats.
Okay, so the farm operators who receive advice about protecting their workers from this infection, let's talk about where they should begin in training their workers about the personal biosecurity involved. How do you propose to provide a message that reaches the people who take care of the pigs?
So we propose a specific type, and that's because we have created them and we have used them already. We have used audiovisual or visual aids to pass the message for producer. It has worked very well for us.
So you've prepared your own set of visual aids, have you, for this purpose?
Correct. Yes. And
And yes, go on.
yeah, they've been very valuable. We're excited. We will keep using them.
Yeah. And what are the vital parts of the message that they provide? I mean, you're an expert on the airborne distribution of pathogens. Is that a key point here?
It is. It's one of the key messages. So it's been helping us to describe this process of airborne transmission. And with airborne transmission, we need to remember that it's the droplet transmission, like large particles as well as the small particles. So it is more and more clear that the airborne component of this disease, when considering the transmission of COVID-19. So we believe that this is a key message for producers. So our audiovisual has helped us to explain that concept.
Okay. And does it also make clear whether biosecurity against SARS-CoV-2 virus should start inside or outside the boundary fence of the farm? Where, at what point does this extra precautions have to take effect?
We can say that the biosecurity for this specific disease that affects humans starts outside the farm. And with that, and then we refer that in our visual aids that we need to be concerned about the contacts that the workers have in their way to work, right? Commuting.
As they travel, as they commute, you
Right,
mean?
right, and
Yes.
we did that in our infographics as we represent the risk during commuting to work with people from different teams. So, because sometimes we know that asymptomatics can be they could be infectious, right, without having any symptoms. But also, it is very important, and we explain that concept to producers that is not only the risk of contact within the farm workers, but it's also the contact that a specific farm worker has within their families and what other contacts have their family, because it's a net of contacts in this case that add risk to being
Yeah.
exposed to the disease.
It could seem quite intrusive, Dr. Alonso, to be talking to farm workers and saying, what contacts do you have at home or in your social life and so on. How do you approach that? It's a very sensitive area, it seems to me.
It is. We just explain them that until we don't get a good protection on a vaccine with this disease, what we need to try to is to keep our contacts on a stable group as much as possible, and that's very sensitive, right? Because we know we all have teenagers at home, or we know we want to communicate and go out, and so. But in this case, biosecurity also consider the contacts from the family to the worker that will consider that will have the worker with the interaction with other workers.
Hmm. Okay, let me pause there for a moment, if I may, just to remind our listeners that we're talking about farm level biosecurity against the novel coronavirus affecting humans. And our expert to help us is independent veterinary consultant Dr. Carmen Alonso. Now, you're an independent veterinary consultant based in Spain, but covering many countries. And are you working in your own consultancy, or how does that work, please?
Yeah, I am running. I mean, my daily work is to help producers and veterinarians in their daily decisions. So I work with my partner Carles Vilalta, and we just created a company called Up North Analytics, where we work with data that producers are already collecting at their farms. So we work with health data from their routine diagnostics, production data, syndromic data, such as cough or sound or water usage, mortality data. With that, we want to create mathematical models for them to help them visualize in their data or estimate potential trends or seasonality of important variables that they need to consider.
Now, this is health oriented, is it? This data focus, as you describe, using cough monitors and things as well as production. So you're trying to have an early insight into a change in health.
Correct. We wanted to have them first monitoring their data and also analyze it and then create future forecasting. So be ahead of what's going to happen. So in a specific change on production or of course health that it will impact production.
Oh, very good. I'd like to talk to you some more about this use of data in that way. I think for another podcast, another time. But let's go back to coronavirus for the moment, if I may, Dr. Alonso. You talked about the external element of the story in terms of the farm workers commuting to the farm and their social life. What about visitors? What does your visual of do your visual aids and your advice say about visitors?
Well, as part of the normal biosecurity program, we try to minimize the number of visits that we do to farms. So as much as possible, decrease in order to decrease the risk of disease introduction. So with our aids, visual aids, where we of course we represent how people need to enter the information at the farm before they come in, and with that, it's just where we ask visitors to be aware of the risk that they are bringing to the farm and try to minimize that as possible.
I'm with you. Now, many of our listeners are field veterinarians, Dr. Alonso. How should a veterinarian be prepared to continue assisting farms without actually visiting them so often? Is it all down to computer screens and contact, virtual contact?
Well, it cannot be all to that because we really need to visit farms and interact and see the animals in a different way that from webcams, right? Um, but nowadays it's more and more common to have Wi-Fi connection at the farm, so we're getting to do that more often, conference calls and interact with teams that way. But at the same time, we know how virus transmit. We can protect ourselves and others with masks. We just mentioned that. So there are different things that we can do, but absolutely, these days are getting a bit challenging to visiting farms as much as we would like to.
Right. You mentioned masks. I have to ask you because I must admit confused. What is a mask? Because there are many types, and I don't know what you would consider appropriate for visitors or for workers or anybody else who's at the farm.
So when I try to explain that to producers or to clients, is we consider two type of face mask, and we explain that very slowly so they understand the difference. So those designed to protect yourself, to protect the person that is wearing it, and those would be an example are those N95 or FPP2, as we say that in Europe. Those are high efficiency filters masks that stop at least 95% of the smallest particles of 0.3 microns that from getting inhaled. So they only allow these small particles 5%. The others are stopped completely. And those are high efficient masks that are really designed to be under a high infectious environment and to protect the person that is wearing them, as I said. But the other type of masks that are designed to protect others. So those are surgical masks or any homemade face mask or covering, and those will stop large particles from getting spread, so getting emitted from your mouth when you sneeze, when you cough, or even when you are on a normal conversation. So in a barn, as we all know, we work very hard on having them well ventilated. So they are well ventilated facilities. Uh, we hope that, of course, they have low viral pressure of this specific virus. In this case, COVID, SARS CoV type 2. So and we also are planning, have already in place strategies to keep social distance. So um, we recommend to preserve those high efficiency masks for hospital personnel and for workers that are at the really first front line. You know what I mean with
You're
that?
extra vulnerable and so on.
Extra
Yes.
and also extra vulnerable.
Yeah.
So just facial covers would be, or
Yeah.
surgical masks would be enough
I
to.
mean, we're as you know, we're used to wearing these face masks against dust on a farm. That would be the most common until now. Those masks are very simple pieces of cotton very often. Would something like that be as good as a surgical mask, or
It
is there
they
any difference really?
they're just very similar. They preserve large particles to get spread, and they prevent others from your own particles that you are emitting. So
Mm,
those will be just fine.
mm. I'm going to go back also. You said about social distancing, and when you were talking about travel, commuting to the farm, you said something about team members. Are you suggesting that the total farm personnel should be divided into teams for which are kept apart as much as possible. Is that what a team would be in this case?
Yes, and whenever the farm, the size of the farm allows us, we try to separate the farm personnel in small teams, and we do that with the special and temporarily. So and with that, we want them to work on a specific team that gets separated from the others, and of course that gets simpler with in large farms, right? With the amount, the quality,
Yes, yeah,
the
it's
number of
much more
personnel.
difficult on a small farm. Yes,
It
sure.
is.
But would these teams be, let's say, separated by production department, or how what's the most practical way to separate teams? Have you found?
So whenever the farm allows it, we tend to separate within the same production area two teams, right? Whenever
Yeah.
it's possible.
Ah,
So
so you've
that
got
way
cover.
there is a
Yeah,
backup, right?
yeah, yeah.
If the breeding people, if everybody from the breeding people gets sick, or so if the size allowed it, we try to separate within the same production area in two teams.
I'm with you. Now, okay, they've got teams. Do they arrive at separate times and eat at separate times and leave at separate times? How are they organized, please?
So we advise them to separate temporarily, and with that, we ask them to arrive at different times. Clear the way for the next team, had it all clean and ready for the next. So it's kind of like when we work on batches, right, at the farm, but also breaks at different times, and also leaving the farm and just
I'm
trying
with you.
to prevent the
Yeah.
cross pathing as much as possible.
Okay, but you're saying when they arrive, the first team would go through the shower and facilities like that, and then when they are out of there, the other team can arrive. Is that the sort of thing you have in mind?
Yeah, that's
Yes,
correct.
I'm with you. Okay. Yeah, Dr. Alonso, you said about social distancing and commuting and so on. And when these teams arrive at the farm, do you have health checks on them as part of the everyday procedure? And also, what happens if a farm worker doesn't feel well before traveling to work?
That's a good question, Peter. I will answer the second one first. So, it's a normal policy in South farms that if a worker doesn't feel good, she or he shouldn't go to the farm. So that's easy. In our audiovisuals, we try to show that sometimes even people that are not feeling sick, that they are asymptomatics, they sometimes are shedding virus. So with that, we also need to is not only if you take temperatures at the entrance of the farm, you're gonna miss these people. So no matter if they're feeling well or they're feeling fine, all these measurements they need to be taken for these asymptomatics. So clear this social distance, team divide the group as much as possible, separate them physically and temporally, and all these washing hands frequently, all that. So we try to prevent transmission within the farm. But at arrival, it's common that not only how they feel, but they also many farms are taking temperatures. So that will also help on getting records, right? That everybody was feeling well that day, and they are taking their precautions, right? That nobody gets in the farm if it's not feeling well.
Yes, I'm with you. You said about washing hands. We're all being advised from the start of the coronavirus crisis about hand washing. Do we need to include that in our farm protocol? How long people wash their hands for and how they wash their hands, and more importantly for me, how about how they dry their hands?
Correct. Drying is a key, and producers they know it really well because it's a key step on biosecurity and sanitation. So drying is a key step that will ensure the correct hand cleaning. So not only that they need to pay their attention on washing hands properly, we also try to encourage producer to have always um, disposable towels, so workers can really do a good job at drying.
And no
Um,
sharing of towels then,
Correct.
obviously.
Just disposable, just paper towels are perfect in this situation.
Right. And at the start of our conversation, when you talked about using our audiovisual tools to get the message across, as I say, we have field veterinarians listening to us. Do you recommend that they create or source such audiovisual aids for use in their advising of clients against coronavirus?
Absolutely. For us, has been very valuable. It is easier. It's always easier to, like, an image is better than 1,000 words, so it's easier to see than to read when you're passing the message. They escape any language barrier. So if there's any different languages in the farm, or there's a lack of communication sometimes because of the language, foreign workers that haven't been adapted yet. So that helped a lot. Also, they provide short and clear message. They're easily downloaded. um, they've been great to share, like just in social media or different type of applications, because they're short and easily managed. So they've been very successful.
For me, one of the things would be that, as you say, farms and farm workers are very accomplished with personal biosecurity. They've lived and worked with that a long time. So, one of the things I would hope an audio-visual presentation might do is say, well, what you're doing is great. Now, we just need to be doing these extra things. These are the extra things, and why. Is that, in fact, how your AV aids approach this? These are the extra precautions.
Correct. We just show them what they do on the daily work that they do, and a great work on preventing diseases to be spread. They just need to take a further step, because it's not only within the farm, it's also outside the farm, and it is important to protect them, because they are the greatest value in our facility, the workers.
Indeed. Now, the advice to the farm workers then can be communicated in that way. May I? We're coming to the end of our conversation for time, I'm afraid, but I'd like to know about advice to the farm operators. And I'll give you an example, if I may. One reads that air conditioning, for example, is a risk factor in the spread of the virus. Now, there aren't that many farms, I think, which have air conditioning, or perhaps there are in offices and that sort of thing. What would be the advice to the operator of a farm about the use of air conditioning?
Well, Peter, first of all, I'm not an air conditioning expert, because it could get very complex. But when consider air conditioning, what we need to understand is what it does in the air, right? In a room, first of all, it decreases the temperature by removing humidity from the air, and with that, after studying for so long aerosols, and consider myself a learner in our biology, what it does, it creates particles of small sizes when you remove uh, uh, humidity from the air. And those small particles are the ones that are capable to remain airborne for longer periods. So that's from one side. And then, well, air conditioning, what it also does is just recirculate air, um, like any other mechanism that we use to move air within a room, right? But it allows a percentage of new fresh air from the outside for just removal exhale air, right? To remove CO2, and that's the way air conditioning works. So to your question, if it's a risk, what we need to, and that will be related to aerosol transmission of SARS-CoV-2 in a facility, like in an office, for example. What it does is to the probability of inhaling enough viral particles to become infected. So air conditioning may facilitate air transmission, right? Because it decreases the size of the particles by cooling or removing humidity from the air. But at the same time, what it does is desiccate those particles. So it's a combination, and it gets somehow complex.
But what's the advice, though? Would it be don't operate the air conditioning,
No,
or
no, no. My advice would be to always allow some fresh air to enter the room, because what allowing that fresh air to remove kind of like do the exchange of new air. What it does, it forces small particles to exhale, like get out of the room, so they don't remain airborne for that long periods of time, and just add new air, and that will kind of like decrease the inconvenience of having air conditioning or any type of, when I say air conditioner, or any type of system that what it does is distribute the air in a room.
Very good. Right, as I say, I'm afraid we must end there, but I must say to you, one of the most positive things of this conversation, I'm quite sure, is that we're putting the focus on the farm worker. As you say, they're the most valuable part of our business, aren't they? And that we're
They
making
are.
them the center of it. And I think to acknowledge their role and to protect their health and their safety is a very good idea for all of us on our swine enterprises. Thank you, Dr. Alonso, very much. In this Meet the Expert podcast, we've been talking to independent veterinary consultant Dr. Carmen Alonso, and now principal of Up North Analytics in Spain, about how pig farms can protect the health of their workers during the novel coronavirus pandemic. Dr. Alonso, many thanks for your help, as I say. Thanks to our listeners for joining us. There will be other podcasts coming along, so stay tuned. Goodbye.